Hi everyone, welcome back to another video, and today we're going to talk about pharmacology and how we determine a safe medication dosage. So I'm sure a lot of you know that when we prescribe a medication, there's kind of a range for what dosage you can use. You can use a lower dose, you can use a higher dose, and there's some guidelines for how you would make this determination, and we do a lot of this during drug trials. So I just wanted to give you some information so you kind of understand the process of where we get these numbers from. So I'm going to pull up this graph, and we're going to base everything off of a graph where we have the y-axis being the percent response. So this is the amount of people in the study population that have a particular effect from a drug, whether it be beneficial or toxic. And then on the x-axis, we have the drug concentration, and this is in milligrams per kilogram because we don't just prescribe a set amount of drug for every single person. It's often based on the concentration for your body weight. So someone who is a lighter weight is going to have less of the drug, probably need less of it for it to have an effect. Than someone bigger, they're going to have more drug per kilogram of body weight. So when we kind of make this determination, we're kind of focusing on the average, what would happen to the average person. And so we're going to focus around the 50th percentile or 50% of the population. And so there's kind of a delicate balance that we need to reach with drugs, right? So there are certain levels of a drug that are effective. And that will give you a therapeutic benefit because, of course, if you're going to use a medication, you want it to benefit people. There's a certain reason why you are prescribing a medication, and you hope that they're going to benefit from it. So this first part of the graph is the therapeutic benefit, and I'm showing this in blue. So as you notice, down here at a lower dose, you have a lower percentage of population having a therapeutic benefit, but as we increase the drug, it's going to increase the amount of people that respond therapeutically, and then that's going to kind of taper off and flatten out at the top to where you're not really getting any increased effect from it. And then right here is our 50th percentile. 50% of the population is right around here. This is a good dose for the average person. But this would be great, right? If I could just go off of this number and, like, why wouldn't I give somebody the highest percentage of a drug? Because the highest concentration here, right, you're going to have almost 100% of the population responding, right? But we can't do that because we know that drugs have side effects. So we have to balance all this out with the likelihood of them getting a side effect. And so the next thing we're going to add to this graph is toxicity. So there's certain ranges of concentrations that will cause toxicity or adverse effects. And you can see by this red graph, it's kind of got the same shape, the sigmoid curve, where a lower dose is going to have toxicity in fewer people. As you increase the dose, you're going to get toxicity in more people. But notice that these graphs kind of overlap a little bit, and we're going to talk about that. But there are two numbers we're going to focus on here really quick. And that is, the first one is the ED50, and this is the median effective dose. So look down here on the graph. We have 50% of the population. Follow this over, follow this down. This is the dosage at which 50% of the population are going to experience a therapeutic benefit. So this is kind of the dose that would give half of the people in the study a therapeutic benefit. And then the next number is the TD50, and this is the median toxic dose. So follow this up again, 50% of the population, all the way over here to the red, follow it down. This is the drug concentration at which 50% of people will experience a toxic reaction. So notice here, there's kind of a gap between these two. So there's a lower amount, usually for 50% of the population to experience therapy, and then a higher drug concentration for them to experience toxicity. And there's this nice little gap here, and this gap we call the therapeutic index. And this is kind of our wiggle room. So let's say we have somebody who needs a little bit more of a drug than the 50th percentile in order to achieve therapeutic benefit. They're somewhere up here. But we can look at this and make sure that they're not getting too much of a toxic dose. They might have some chance of side effects down here, but it's very rare. So sure, I could, with this drug here, there's not a lot of overlap. If I give them a nice drug dosage up here, it's very unlikely that they're going to have toxicity. But I'm going to talk about a different drug and why the situation might change. So this therapeutic index is really nice. It gives us a nice range, a lot of wiggle room to prescribe a drug. But let's say we have a different drug, and we're going to use an example of a drug called digoxin. And digoxin is a cardiac med. It's used in heart failure. It can be used for certain arrhythmias. And it comes from a plant called foxglove. And it has toxicity in very low doses. It can be very, very dangerous. So as you notice, our curve for toxicity moves to the left. So it's a lower dose at which you would receive toxicity. And notice that the TD50 is now lower. So 50% of the people require less drug to have adverse effects. So what does this do for our therapeutic index? Right? It's going to be smaller. So look at this window. This wiggle room is a lot smaller. So as we go higher up in our dosage, sure, we'd get more therapeutic benefit, but we'd also increase our risk of toxicity. So this might not be a great drug to prescribe a lot of people because you're going to experience toxicity with a high percentage of the population at a therapeutic dose. So this drug is not going to be as great. Whereas look at the other one, we went from this window down to this window. So you see how this could be a problem and how we get different dosages now for these two different drugs, where the first drug was very safe and the second drug is really not so safe. So how do we calculate this out? So we are going to use these numbers. We don't need to draw a graph every single time we do this, but we can use these two numbers, the ED50 and the TD50, to determine how far this gap is and kind of what we're dealing with. How safe is this drug to prescribe? So our TI, our therapeutic index, is going to be equal to the TD50 divided by the ED50. So let's just take random numbers here. So let's say we have, 25 for our TD50, 25 milligrams per kilogram, and then our ED50 is 5 milligrams per kilogram, right? Our therapeutic index is going to be 5, right? So this is a pretty good sized gap. We have a lot of wiggle room. Let's say we have a different drug now where our TD50 is 6 and our ED50 is 3. So our therapeutic index is 2. So, right, this gap is smaller. So it's less likely that we're going to get a good effect without toxicity in this drug, whereas with this drug's going to be pretty safe. This drug's going to be pretty not safe. So I hope this kind of made sense. I'm going to go into more videos about pharmacology, talking about drug dosage and how we determine safety of other types of drugs, more on an individual drug level, how we get you up to a loading dose, what is a maintenance dose, that kind of thing. I hope you liked this video. Please like, comment, and subscribe. I will see you all in the next one.